happy to participate in the launch of the Africa Health Markets for Equity program for electronic system for identifying the poor. About 3 years ago, the National Health Insurance Authority started working with Ahme partners to develop this project to address some of the challenges facing the NHIS, especially in the identification of the poor and vulnerable populations, as well as improvement of quality of healthcare services through supply-side interventions. We deem this approach as important in view of the fact that by design, the NHIS is a pro-poor program that seeks to provide financial risk protection and access to quality basic health care for all residents of Ghana, especially the poor and the vulnerable. 12 years following its inception, the NHIS, as of the end of October 2015, had 10.9 million members. This represents approximately 40% of our population. Over the years, coverage of the poor and vulnerable populations has also grown. As we strive as a country to attain universal health coverage, we recognize that we must do more to remove the barriers that hinder the enrollment of the poor and vulnerable onto the NHIS. In our pursuit to ensure that poor and vulnerable populations are not left out of the scheme, the NHIA has over the years partnered with the Ministry of Gender to register leave beneficiaries onto the scheme, and most recently assist in developing a common registry for the poor and vulnerable. The event we are witnessing today is one of such partnerships.
Africa has many poor people, but it also has very many rich people. And as you know, in all our countries, people who are extremely rich, when they are sick, are not even treated in Africa. They go abroad to seek treatment. People who are middle class are treated here, but they cannot meet the cost of care. People who are poor, especially those ones who are extremely poor, often have nowhere to go, and when they get that care, it makes them even poorer. If there's one thing that we have in common as human beings and as Africans, it is that we all fall sick at one time or the other. We all have relatives who will fall sick one time or the other. So the issue of healthcare cuts across nationalities, it cuts across ethnicities, it definitely cuts across all the socioeconomic classes. What is happening here today is a hallmark for the whole of Africa. For one reason, you are, as Ghana, providing yet another step in leading Africa in extending health insurance to everybody. That is one of the few things that you are leading us on. Number two, you are also leading Africa in mobilizing the poorest at the community level, using all the traditional structures to make sure that they take advantage of this very, very big gift. So we want to congratulate you, Ghana, and you must be extremely proud of what you are doing here.
As a government, Mr. Chair, we welcome and appreciate all the complementary efforts to what we are doing and seeing here today. We see this as a vote of confidence in our efforts as a people and as a government. This initiative will ensure that every Ghanaian in Ghana and every person living in Ghana gets what they rightly deserve. That is why I'm happy to be here this morning. The World Bank Group, Mary Stopes, Farm Access have presented items worth $200,000 to the Ministry of Gender, Children and Social Protection. This was done yesterday. Please let's give them a big clap to say a big thank you to them. Me, Chair, these items and equipment that was presented to us on behalf of the government of Ghana will help us to reach the remotest parts of Ghana, the rural areas, and very importantly, the poorest of the poor, so that we can register them on national health insurance, on LEAP, and our other social protection interventions. We believe as a government that universal access to health care, education, affordable food, electricity, housing, and water is the right of every Ghanaian, especially the poor. And we will do all in our power as a government to work to make this right a reality for every Ghanaian. I welcome you to this program and formally launch the AHME program in Ghana. Once again, we're very grateful to the World Bank Group and all the partners for your continued support. Shida, Shida, Nyayuado.